I mean, throughout my life, I've always had stomach issues. You know, they always say hindsight's 20/20. But you know, as I thought about being a child, there were many instances where I was in the bathroom or I'd eat something and it disagreed with me, and I never knew what it was. And my mother and father, you know, they always referred to it as the Marshak stomach, as if it was just this family thing that everyone had, and it was your lot in life to deal with. And so I was used to a lot of discomfort, gradual discomfort, but I never really thought it was anything more than that because it's what I knew my whole life. There was no sign that I had the days before that something different was happening. It was status quo for me. But on December 12th, 2013, it was as if someone flicked a light switch, the pancreatitis light switch, and it was on. And from that moment, literally grabbing my side, and my life was going to be forever changed at that moment. I knew something was going on. It was not gradual. It was a very acute episode that happened. Well, on December 12th, 2013, I just started to feel a little nauseous after I ate a meal my wife cooked. And I was asking her about the meal, wondering maybe it was something that I ate. And then gradually, within an hour period of time, the pain became intolerable, you know, where I was writhing in pain. I didn't know what it was. I wanted to do anything I could to make myself feel better, whether it was sticking my fingers in my throat, just trying to get whatever this misery I was. I thought it was maybe a stomach virus or something like that. But the pain was, I couldn't even sit still. It was just the most excruciating pain I had ever felt in my life. When it first happened, I was supposed to go to my son's music concert. And my wife, Laura, and I were going to go together. And once this episode hit, I couldn't go anywhere. So I told Laura, my wife, I said, I can't go, you got to go. And while she was at the concert, the pain just escalated, and it was tremendously painful. And I called her telling her, you need to come home. I think you need to take me to the hospital because something's wrong. I knew something was wrong. I had never felt anything like that in my life. And she came home, and I think at that point, I could see the concern, not that she's not always concerned, but there was a level of concern, and being that she's an RN herself, I kind of saw the look of concern on her face, and she immediately drove me to the hospital. I knew at that point my life was forever going to be changed. I just had this feeling like something severe was happening. I didn't know what it was. I didn't know where I was going. I just was at this point at the mercy of the first hospital I went to, and anything to remove the pain, that was on my mind. That was the only thing on my mind at that point. The pain that I experienced on that night was around my entire abdomen, you know. Although the pancreas is back here, it radiated. I felt it down here. I was grabbing my lower, I don't remember if it was my right or left side, but it was just a pain that a stomach ache like I've never felt before. When I first arrived to the hospital, you know, they ask you, how's your pain, you know, out of scale of 10, you know, 10 being extreme. And I remember clearly saying, it's 10 out of 10. This is the worst pain I've ever experienced. And they took me in, they drew some labs. And, you know, at that point, I didn't know what was going on. I think they initially gave me some pain medicine because they knew that I was in a lot of pain. And at that moment, I didn't know what was going on. And to be honest with you, I was just really trusting my wife at that point that she was going to figure out, you know, I was looking to her to tell me what was going on and interpret whatever the doctor said. The first thing she told me is that you have pancreatitis, and that my amylase and lipase levels were, emergency room physicians said they were some of the highest he had ever seen in his 20 years of practicing. And at that point, I didn't even know what amylase and lipase was. But there was a sense of concern that everyone had and I looked at my wife's eyes, and I could tell that she was a little scared. All the physicians and nurses were speaking to my wife because of the condition I was in. I was in such pain. And she told me I had pancreatitis, which at that point meant nothing to me because I didn't know what it was. But I knew there was a sense of severity. I looked in her eye, and I could tell that I was going to be in the hospital for a while. I think part of the process as a patient, too, is sometimes you find out what you're dealing with, and you have to go through your own education of just understanding some of the terms that the doctors are using and just coming to terms with what you're going through. Well, I mean, the first weekend I was in my community hospital, and I was in a tremendous amount of pain. And I remember they wouldn't let me eat, and they were changing my diet and allowing me to have some basic food. And at that time, I wanted to eat. I didn't understand anything about the pancreas and that what was going on and how eating would compromise what I was doing and actually make it worse, which I ultimately learned later. And I think I was there for 2 days or so, and I think my white blood cell count became even more elevated, and I having difficulty breathing, and they transferred me to the ICU at that hospital. And I think that at that point, I kind of knew they moved me, and I wasn't feeling as well, and I didn't know. I could just tell there was a sense of fear in my wife's, in her eyes and her voice, that she was scared. And I think at one point, truthfully, she came into the room and said, "Listen to me. I know you're going to argue this with me, but we have to transfer you. We have to go to another hospital. And if you don't, it's not going to end up well." And I remember saying to her, "Do whatever you need to do." I trusted her more than anyone. And, that first week in the hospital was very scary. One, it was very painful, but I didn't know what was going on. And I didn't feel like I was in the hands of somebody who actually knew. Yeah, they knew I had pancreatitis, but as far as how to manage it, surgery seemed to be the only option at that point. The surgeons were coming in and they were viewing me as a surgical candidate for them to do their thing on. And at that point, we're all conditioned to think, oh, doctors know, they're a doctor, they're telling me this. And I assumed that their way of treating it, that they knew all of the latest ways of doing it, which was not the case. They were telling me that the surgeons were coming in, they wanted to get at my pancreas through surgical means. And I knew enough to know that where the pancreas is located, that involved a very difficult surgery. At this point, I was so sick that I was trusting my wife, but I knew enough that my life I was on this slide, so to speak, and that I had no control of what was going on. My control was completely in the hands of these doctors at the time and my wife to discern what the best course of action was. A friend of mine, Dr. Byrne, who's coming there to visit me and also just to be an ear listening to these doctors, and he's the type of person who doesn't inject his opinion. But he heard what they were saying and saying that surgery was the only option. And at that point, I think he actually became vocal with one of the doctors. He said, that's not the case. There are other ways of treating this out there. And I could sense he was my advocate at that point, along with my wife. And I think he helped my wife get the confidence to realize that there's a better way to do this out there. And at that moment, we didn't know exactly how or what, but he knew one of his colleagues, who was a friend of Dr. Kahaleh, he reached out to him. And his colleague said, "Look, I'll take him as a patient, but my colleague, Dr. Kahaleh, he's the guy you want to see. This is exactly what he does and his specialty is." And, he's in one of the leading people in the world in this field. And so at that point, my wife I could see a glimmer of hope in her that, wait a minute, we got to get him there. That was the mission. How are we going to get Chris to Dr. Kahaleh's hospital? And in the local hospital, they gave her a little bit of trouble, why you can't move him in this condition, they can't do anything that we can't do, and it just was not the case. I think most people want to believe that their doctor is the best. They want to trust their doctor, because if they're going to a doctor and he's not, and so there's a conflict within the patient. So they want to think that their doctor is qualified. He's the best. And you hear patients talk about their doctors in such a way. But the reality is, in this case, it wasn't the case. If you have a hammer, if that's your mode of experiencing the world, things become nails. You look at ways to use that. But if you have a hammer, a screwdriver, and other tools in your toolbox, you can do more subtle, nuanced things, and that's what Dr. Kahaleh was able to do. He had more to offer, and they were seeing it through the eyes of the skill set that they had. And I believe they were doing the best they can, but it was very limited. And and frankly, it's a local hospital. It's a business. As much as I went in there, I was, they're in business to make money, and that they honestly believed that they could help me. And it's a community hospital. It wasn't a teaching institution, so there is a skill set of, I'm not saying all doctors are complacent, but there's a sense of complacency where, you're the local hero, you're the big fish in the small pond, and people look up to you and they don't question you. And had it not been for my wife and my primary physician questioning and doing the research and realizing, even if they didn't know exactly who and what, that there was definitely a better way out there for me. There was another solution, a more minimally invasive way of dealing with what I had. The reality is, when you're in a hospital and you're sick, most people are conditioned with the paradigm of don't move them, you're going to make it worse. And that's not the case. That's the one thing I could tell anybody, that moving them, was the best thing that happened to me. And that while it's your local hospital and it's familiar and it's close to your home and all the easy things there, when it comes to a life-threatening illness, that's worth nothing. You want to be, if it's an hour away, you want to be with the best. And That's what my wife was trying to give me. She wanted me to be with the best. And that's ultimately what made all the difference, I think. When I knew I was getting transferred, I can remember that the transport team came, and it was the paramedics associated with Dr. Kahaleh's institution. And immediately at that point, I knew that I felt a sense of these guys know what they're doing. There was just a higher level care that they operated at. I remember them picking me up at the hospital and taking me to the other hospital. And it was in the middle of the night. I didn't know where I was going. I didn't know what was going to happen next. But I knew there was this doctor that was taking me at this other hospital. And I was at this point, I was hanging my hat on that. And I saw the confidence my wife had at that point, that she was like, she had a little hope. So I was kind of following her lead with that. And then when I got there, I was there. I got taken on a Saturday night. And I was basically, they kept me status quo for those 2 days until I met Dr. Kahaleh on Monday morning. And that's when things began to take a dramatic turn for the better. When you're sick, you realize, and as you go through your process of being sick, at some points you're the top priority. But then as you get better, you realize that there's someone else who is where you were a month ago, and that he would be treating other people. And so sometimes you're supposed to get in a certain time, but the reality is you're supposed to be in at 1:00, but you'd be 4:30 and you'd go see Dr. Kahaleh. And when I first met him, I remember I was on a stretcher, and he walked in and he had a smile on his face. And there was a sense of confidence that I immediately saw in his face. And he had a smile, and he said, "We're going to get through this. It's not going to be easy, but we're going to be laughing about this one day." And I saw my wife laugh a little bit. It was just the first time in about a week and a half of being in the hospital, and there was people laughing. There was a sense of confidence. There was a glimmer of hope, and that ultimately was needed at that point. It was going to be a long road still ahead of us, but there was a sense when Dr. Kahaleh walked into that room, he knew what it was. He knew what it was, and at the community hospital, most of the time, pancreatitis is associated with alcoholism, and I was not a drinker, and they want to fit you into that. I think it speaks to the mentality of they wanted me to fit into their box so they could understand it. But what I had was gallstone pancreatitis, and essentially I had unformed gallstones. If a gallstone was a snowball, I had snow, and it didn't show up as a mass, but it was in there. And only when Dr. Kahaleh went in endoscopically was he able to see this. And actually, in the first procedure, he drained it. He did a sphincterotomy, which allowed all this material that was in my bile duct of my gallbladder and drain it out. And he actually made the opening larger so that if there was more sludge to come out, it would flow more easily, thereby preventing the situation from getting worse and minimizing the damage that had already been done to my pancreas. So the first procedure, when I met Dr. Kahaleh, he brought me in, and the first thing he did was, at this point I didn't know. I knew I was infected. There was an infected mass, and when I had this necrosis, essentially, was this infected mass on my pancreas. And I knew early on that you had this infected mass, and the first thing they wanted to do was they said it walled off, which was a good sign. So in other words, it built a somewhat barrier around the edge of it that was going to keep it contained, which would prevent it from spilling over. And so I had this infected mass. Well, I had this infected collection on my pancreas that had it burst, I would have died. I would have become septic, and I would not have made it. So, he went in there. The first one is to drain not only the sludge out of my bile duct, but to drain this infected mass, And the way he did that was endoscopically. He went in through my mouth, into my stomach, through the wall of my stomach. He was operating on my pancreas. And if you think about this, it's amazing. Traditionally, if you had this done, they would have to do a Whipple procedure, which would open you up, and your pancreas is located behind your stomach. So what's involved, moving your organs, the risk for infection, talk about minimally invasive. This you probably couldn't create a more invasive procedure than the Whipple. And Dr. Kahaleh just bypassed all that by going into my mouth, into my stomach, through the wall of my stomach, and he was able to take, using a stent, various stents, drain this infected mass into my stomach, the one part of the human body that could tolerate this infection, the only part of the body. And by draining it into there, initially he did it on the first procedure, but a series of procedures thereafter where he did the same thing, enabled me to eventually get rid of this infected material and get out of this infected state where I no longer had an infection. And then it was just a question of getting the fluid collection to become smaller. But then initially the infection was just as much of, was the biggest thing, because that I was having fevers, and, the danger of becoming septic was, you could see that was everyone's concern. So when I saw Dr. Kahaleh, it just this sense of confidence. And in that first procedure he did three things. He cleaned out my bile duct, which had all the sludge in it, which he did a sphincterotomy, which opened it, allowed it to flow. He also drained the infected necrosis, this infected material, into my stomach. And he also put in a feeding tube. Now, mind you, a feeding tube was something I was like, what? You can't eat for 3 months? But his philosophy, and part of the reason it is so effective, is that it shuts down the pancreas, completely rests the pancreas to prevent more damage and allow the pancreas to heal. And while some people may not want to do that because they want to eat, I just knew at this point, I had complete trust in this man, Dr. Kahaleh, that this was the only way for me to get out of the situation I was in. No matter how drastic it seemed at the time, that was what was done. And I remember coming out of there, and I had this tube in my stomach that was going to feed me for the next few months. And it wasn't easy. I'm not saying to you that there's no magic bullet with pancreatitis. It's an ongoing thing. But knowing you're in the hands of somebody that could take each little thing that they do and evaluate and make those little subtle changes, it's an artist. It's really an art. What he does is an art. And that first procedure was where he kind of, I think, stabilized me and just put the feeding tube in, which allowed me to eventually rest the pancreas, which ultimately played a huge part in why I was able to recover completely. So after the first procedure was done, my first day in the hospital was a month. I was there for a month, and I believe I was there probably another 5 or 6 days where I was still infected. I was still infected. I had an infection, which is not uncommon. But Dr. Kahaleh again went in another one of these procedures, which are called ERCPs, where he goes in endoscopically and drained again. Moved the stents, and I believe the first one, maybe one of the stents came loose, so he restented, and it was another procedure. And I think over the course of the month that I was in the hospital, I believe I had three ERCPs while I was there. While you're in the hospital for this month, you're in a lot of pain, even though I know intellectually that I'm in the best hands I could be. That just the toll of your pancreas and the pain that comes from the pancreas is excruciating. I had some issues with the feeding tube and stuff like that, and figuring out which was the right formula, which is all part for the course. This is part of, any treatment. But Dr. Kahaleh was able to adjust all the, as things came up, we kind of figured it out. I guess after a month, I thought everything was fine. I was going to go home, and they released me from the hospital. But in retrospect, as I was leaving the hospital, I was still not feeling that great. I was feeling much better than when I first went in, but I still was not feeling. I just had a weird intuition that maybe I might be back in the hospital. And I went home. I was home for a week, and my wife's an RN. She was taking care of me, but I still was spiking fevers, and I'm not feeling well. And I remember she called Dr. Kahaleh one night, and I was spiking a fever, and he said, "Bring him back in." And it's not uncommon for someone who has an infection like this it's a process. Doesn't, sometimes it may happen, you may do one procedure and you're able to remediate the situation, but most of the time it's that's why I said when I described it as an art, it's a nuanced, draining, wait and see, And so after being home for a week, when I was thrilled to come home, my kids were going to see me. So when I was home, not feeling well, Dr. Kahaleh said, "Why don't you go to your community hospital to get stabilized?" So I went up there. They gave me some fluids, some pain meds, and then Dr. Kahaleh arranged for a transport back to his hospital. And then I went back to the hospital where Dr. Kahaleh works, and he did. I think we did another ERCP or two. He put in a stent, another stent, a big stent. And I believe, and keep in mind when he was doing these procedures endoscopically to put the stent in, he had to put it down my throat. So it had to go in my mouth, down my throat, and he put this big spool-like metal stent, which was at the time, it had I can't recall exactly, but it could only be in my body for a certain period of time. And so Dr. Kahaleh put it in, and I was in the hospital, but I knew it couldn't stay in, although I kind of hoped it would, because when you're sick, you just procedure after procedure, it takes its toll after a while. But when they finally did remove this stent, a bunch of the necrosis and infected material came out and was attached to it and was pulled out at that point, which was a good sign. And I believe I was in the hospital a week the second stay. And at that point, when they let me go, I was feeling considerably better than I had ever felt before throughout this whole process. And I was going home. And while I was at home, I was still going to see visits with Dr. Kahaleh. And keep in mind, I had this feeding tube in. And initially, when I was so sick, I wasn't thinking about eating because I was dealing with my pain. But once the pain starts to subside a little bit, and you see people eating and doing stuff like that, and you're not eating or drinking anything, it was challenging, to say the least. But, again, the reason I was able to deal with this, I had this trust in Dr. Kahaleh, that this man knew what he was doing, and this was the plan, and I was not going to do anything but trust this man. And that's part of the reason I am where I am today, is because I did trust him. So when I was released from the hospital the second time, I was home, and I was going to see Dr. Kahaleh for visits, and I was also going for imaging. I have a procedure called an MRCP, where they would able to them to see the ducts. They would actually give me some type of injection that would allow the ducts to open and see what was going on. And I had a couple of these images, and my fluid collection on my pancreas was continuing to get smaller. There was a sense of, we were all positive. I felt very good about the way things were going. And I felt like I was just out of the woods, so to speak. And one day I got a call from Dr. Kahaleh's nurse practitioner. And she said, we got a setback. I said, what's going on? She goes, we noticed your fluid collection has dramatically increased. And Dr. Kahaleh wants to schedule you immediately. By that point, I was kind of broken. I was very discouraged. And I remember going in to see Dr. Kahaleh. And normally when you go in for your endoscopy, very oftentimes, anesthesia puts you out. So he wouldn't be in the room. He would come into the room, obviously, to do the procedure, but he wasn't in there before. But I remember sitting on the table. And at that moment, I've had probably 5 or 6 of these procedures already. And I'm just, the emotional toll of things, it just really hit me. And I remember just crying on the table. And they said, you want to see him? I said, yeah, I want to see him. And he came into the room. And he was like, what's the matter? This is nothing. This is nothing. What are you worried about? This is nothing. This happens. We're gonna drain it, and we're gonna be fine. Trust me. And I remember at that point, just wiping my tears away and just being like, all right, I'm gonna trust him. I'm gonna put my faith in this man who's got me this far, where I remember where I was, and here I am. And I did. After this procedure, this ERCP to rectify the fluid collection that had come back a little bit, I was feeling fine. And then one day I was at home, and my wife was at work, and I just felt, I don't know, I just started to get sweaty, and I called my wife at work. I said, something doesn't feel right. I'm like sweating. I feel like I'm going to pass out. I didn't know what it was. And she was actually she called an ambulance. My wife was at the hospital, called 911 while I was at home. Because I said, I think I'm going to pass out. I felt like I was going to die. I didn't know what was going on. So ambulance came, took me to the hospital, and they checked me out at the community hospital, and nothing was revealed at that moment, but it turned out that I was bleeding internally somehow, and we didn't know why or what it was from. But it must have resolved on its own. And again, throughout this process, you're going through all these little setbacks. Well, they seem like little things I'm talking about now, but cumulatively, from being diagnosed with pancreatitis, it was very difficult. And along this whole process, Dr. Kahaleh instilled this sense of confidence. And I remember when he did an endoscopy on me after the bleed, he wanted to see what was going on. And it was an endoscopy that happened around 5 or 6 in the evening. And I remember him came in, he must have been lecturing because he's also a professor. And he came in a suit, and he rolled up his sleeves. And I remember him just walking in the room, and that was just very soothing to me. At that point, I had already had a tremendous amount of confidence in him. But I said, he's going to take care of this. I just figured out, I just put my trust in him. And when you're sick and you don't know what's going on, and to have somebody that is an expert in what you have, and that you're not the first person that they've seen. And that while it's scary for you, they're relaxed and confident because they know that they've seen this before and that the outcome is going to be good. And they're so confident about it, not in a cocky way, but just in someone who knows what they're doing. It's kind of like an airline pilot. You know, you want somebody who's confident when they're flying that plane. And Dr. Kahaleh has that confidence in what he does. He's compassionate, but there's a confidence that he exudes that when you have nothing to hang your hat on, that it's very soothing to have someone like that. After that, you know, there were no other real setbacks. Initially, when you have a feeding tube in and you're really in a lot of pain, you're not thinking about eating. But towards the end, when you're feeling better, and you still are eating because it's what the doctor ordered, you know, and you're watching people eat, and you know, you have this food envy, I call it. You know, you want to eat. You know, it's just a natural human emotion. And keep in mind, by this point, 3 months, I haven't eaten anything by mouth, or drank in anything, put anything in my mouth, liquid or solid. So it's, you know, it's a pretty drastic thing. But again, I think that's Dr. Kahaleh's part of the reason that I know, I don't think, I know, is because my pancreas was able to rest and the damage was minimized. And that's a result of the feeding tube and the many ERCPs that Dr. Kahaleh did, where he was able to gradually remove this infected material from my pancreas and allow the fluid collection to resolve itself. The point where I was given the green light to eat, that in itself was symbolic, but the idea that I could eat, that chapter was behind me in terms of that I was out of the woods, so to speak. And I can remember eating that first meal with my wife, miso soup, and it was the best soup I've ever eaten. When you're given the green light to eat, you know, Dr. Kahaleh kept the feeding tube in just as a precautionary procedure, just to make sure, see how you handle the food, your digestion, and in the event that if something were to not go right, they wouldn't have to put another feeding tube in. For that month, I was eating, and I had this appendage sticking out of me, this feeding tube, which was no longer being used. And, you know, but really the eating was very symbolic of just the sense of like, I'm doing well. You know, I think I'm out of the woods here. And I felt good. I didn't have pain anymore. And you know, I think the final period at the end of the sentence was that Dr. Kahaleh wanted me to get my gallbladder out. So that was something that, you know, was in my mind was the only thing that needed to be done at that point, to bring full resolution to what I had gone through. Well, I think that the idea, his feeling was that the gallbladder, while there's a good chance nothing could happen, that nothing good could happen from it being in. And since it was ultimately the cause, the sludge was ultimately the cause of why I was there, no reason to keep it in. And at that point, you know, if Dr. Kahaleh had said, you know, lie down on the floor right here, I'm going to take it out, I would have done that. You just want to do whatever you have to do to put this behind you. I am a professional drummer, percussionist for a living. I play with a lot of different people, and my body is a big part of what I do. I need my body, you know. And when I was sick with pancreatitis, my body was hurting. I was out of commission. I was worried about how I was going to provide for my family, let alone play again, which was something which was very fulfilling to me. And Dr. Kahaleh enabled me, one, to earn a living, to provide for my family, get back to that, and also to do the thing that brings me probably more joy than anything, and that's to drum. And I'm eternally grateful for what Dr. Kahaleh did for me. Throughout this process, you know, drumming was the one physical activity that even when I could barely play, I would sit down for 5 minutes. My wife would say, you need to get out there. And I would play. And first I was so tired I could play for 5 minutes. But I knew because it involved using all my limbs and playing that therapeutically it was going to be a good thing. So throughout the process of my healing, as I became feeling better, I would play more and more and more. And the music came back into my life. And so as I physically was getting better, I was able to drum more. And I think that goes in hand with my happiness, and was a good indicator of my progress towards becoming healthy again. I remember being in the hospital at one of my sickest times, and you know, when you're a patient, doctors start to view you as a sick person. And I remember whipping out of my phone and showing one of my doctors a video of me performing, playing the drums, because I'm a drummer. That's what I do for my living. And I remember the doctor looking at me. He goes, "That's you? You got a long way to go." And here I am, 4 years later, playing better than I have ever, more than I have ever. Life could not be better in any regard. And because of Dr. Kahaleh, here I am. And I'm extremely grateful. What made the process happen was that it was already laid out. It wasn't maybe we'll do this, maybe we'll do this. His conviction, Dr. Kahaleh's conviction, and his vision on what needed to be done made all the difference in the world. And I trusted him. I did, my wife, my family, I put my life in his hands, and I trusted him. And through that, I've never felt better in my life. At one point while I was in the hospital, one of the nurses kind of made a comment to me. Goes, you know you're in good hands. I said, yeah, I know I'm in good hands. She goes, do you know about Dr. Kahaleh? And I said, yeah, I know he's good. I know he's really good, and he's very respected. And she said, yeah, he's more than respected. He's been in over 300 different publications, the work that he's done. And I have friends that are in the medical profession, and a lot of them aspire to get one publication. I think it's a testament to Dr. Kahaleh and the work that he does, that he's trying to take this field of endoscopy and push it forward. And in the most minimally invasive way, help patients achieve better outcomes without the risks and all the benefits that I've experienced. My name is Chris Marshak, and on December 12th, 2013, I was diagnosed with acute necrotizing pancreatitis. If I had not met Dr. Kahaleh, I honestly don't think I'd be here today. Some people get pancreatitis and, they get slight inflammation of the pancreas. I hit the jackpot when it came to pancreatitis. I had as bad as you can have it and still be alive. And, not all doctors are created equal when it comes to pancreatitis and the way they approach it. And at the community hospital I was at initially, they thought their way of treating it was the best, but it's not. They had a very limited vision based on their skill set. And through an extraordinary set of circumstances, I came into contact with Dr. Kahaleh, and from that I was able to gradually been taken from the depths of despair and a life-threatening illness and brought back to the condition I am today, where I'm leading I'm very healthy, and my digestion is better than it's ever been, and I'm blessed with a wonderful family, and I'm here today, whereas I honestly don't think I would have been. My name is Chris Marshak, and today I should not be alive if it were not for Dr. Kahaleh and his team. I don't know where I would be, but I know I wouldn't be in the shape that I am today, which is healthy. My name is Chris Marshak, and I shouldn't be alive today. But I am, thanks to an amazing doctor. I guess if someone has been just diagnosed with pancreatitis or finds themselves in a situation where, maybe you're watching this video because you just Googled it and your loved one is in the hospital right now, I can tell you that there is a way of doing this in a minimally invasive way. When it comes to pancreatitis, in most cases, surgery is not the way to go. And that there are people like Dr. Kahaleh out there doing it in a minimally invasive way. This necrosis that you have on your pancreas can be removed endoscopically, no incisions. Can go in through your mouth, into your stomach, same day. A relatively short procedure with no incisions, and the risk of infection is almost, it's very small, and the outcome is so improved this way. In my case, when I was first brought to the hospital with my acute necrotizing pancreatitis, the only option I was presented with was surgery, and that was all I had to look at until Dr. Kahaleh came into my life, and I realized there was another way, a more minimally invasive way to deal with this, that didn't require incisions, that allowed him to go in if necessary, which is often the case, where he has to revisit it and tweak it, because it is an art, what he's doing. And if you have to open up your body each time, the risk of infection is greatly increased. So the idea that surgery is definitely not the only option. And thanks to Dr. Kahaleh and what he's doing, without Dr. Kahaleh, I don't know where I would be. I honestly, there's a very good chance I wouldn't be here right now. Definitely. I'm not exaggerating in any capacity. What he did for me, my family, and he took a situation that was full of despair, where it was a very bleak situation, and he shined a light on it and gave me hope. And through his expertise and confidence and vision in what he does, was able to get through this process of pancreatitis, which is not an easy thing to go through, even in the best of circumstances. But having the right person at the helm who knows what they're doing made all the difference in the world for me. And my sense of gratitude towards Dr. Kahaleh, words don't do it justice. I really honestly believe he saved my life through the techniques that he's using and his expertise. Dr. Kahaleh, I want to just express my gratitude towards you for what you've done for me. And I thank God every day that you came into my life. I know my children are extremely grateful for what you did, being a father and a husband, that I'm still here because of you. And anything I can do to let people know about what you're doing, I'd like to do that. And my hope is that what I've said here today, maybe someone who's going through what I went through hears this and does get a little of that hope, and realizes that there is a better way and that surgery is not the only option. And thank you.